Everyone. Welcome back to another Citrus podcast. Today we have a special guest here today. Her name is Mariam. So welcome, Mariam, to Citrus podcast.
Hi, Vartanjan. Thank you for the invite.
Uh, Today's topic we're going to talk about AI in healthcare. Mariam is a clinical QA specialist, and she'll be talking about AI in healthcare. So, Mariam, what do you think about AI in healthcare today?
What I would say, Vartan, that AI already entered into our everyday's life, not only in healthcare, but in every sphere. And it's getting more and more intense and it expands. First, I would say we can see both positive and negative impacts. I would say, let's start from positive ones. What I would say, let's say virtual assistants, or when you want to type something really quick and you don't have time or you don't want to use your hands, let's say you are doing multitasking other jobs and stuff, it can help you a lot. Like you can do the text message or you can compose the whole email or a passage via voice or giving a simple command, you know better than me. So I think like work wise, it's a great help, not only in healthcare, but in everyday's life, as I said. But if I specify in healthcare, I would say, first of all, it is helping to make all the paperwork digital, first of all. Because in my work, I work for different offices, I go to hospitals sometimes and stuff, we have a lot of paperwork, a lot. We need signatures and stuff, but through AI, it's a little bit easier and faster because, nowadays we have like electronic signatures and we can just scan or put those information online digitally in the folders or in the computer in the system somehow, which is I think is a great opportunity for us to save time and make our work more effective.
Okay, so basically, it's need of automation, correct?
Correct, yes.
So more automation, so it can tackle those tedious work and tasks for that.
Mm-hmm.
Okay.
We would say about the negative part, negative impact for that. I would mention that, let's say, sometimes we are too dependent on our cell phones. We are too dependent on like some specific programs and stuff. Let's say Google Maps. Let's say, I don't know, iMessage and stuff. Sometimes we are so dependent that there was when I came to the States, let's bring an example. I didn't know the roads very well. I used to maps a lot and I was like depending on them a lot. Now I know, thank God, more than then. But there was a time when I was driving and I didn't know where I'm going and the system shut down. I had no charge and I don't know where I'm going. So I don't want us and like for future our kids, our new generation and stuff to become sort of, I don't want to say this too intense, but sort of disabled, I don't want us to be like disabled people. I don't want us to depend on it too much because, like that, we are becoming lazy.
Okay.
So we starting relying and trusting the AI or the, I don't know, specific program, which makes our lives easier, of course, but it's becoming like, what should I call it? Like it's a necessity. Let's say if I go to nature, if I go to a beautiful place and there is no internet and stuff, I would enjoy that. But some people, they will go nuts. They will go crazy if there is no computer, there is no Wi-Fi, there is no specific, you know what I mean?
Right.
So that's the biggest negative impact, I think, which I would like to stay away. Yeah.
So do you think that AI will replace nurses and doctors in 5 years or something?
I would tell you it started already replacing, sort
Really?
of. Yeah. Not
How
like,
so?
Yeah, I would bring a beautiful
Sure.
example, which
Mm-hmm.
is like which happened to
Mm-hmm.
me. One of my closest
Mm-hmm.
relatives,
Mm-hmm.
she had a surgery of a
Mm-hmm.
colon,
Mm-hmm.
which is like very very
Mm-hmm.
like gentle job, for
Mm-hmm.
even for the best like surgeon, the most skilled surgeon
Mm-hmm.
cannot perform that so precisely than AI or a machine or a robot. Of course, it's controlled by a doctor or a nurse or whoever, the medical, of course, professionals. But the robot, the machine, which of course it was AI, did the surgery, I guess, if I'm not mistaken, within 5 to 7 hours. But if a doctor did the same surgery of colon,
Mm-hmm.
because it's a very complicated surgery, it would take him like maybe 14 hours.
No way.
You
Wow.
see,
And did the AI robots made it efficient though? Was
of
it all
course,
clear?
all clear, all clear.
No way. That's
And
scary.
that's sort of
That's
scary,
scary.
right? And
Wow.
recently, another news
Mm-hmm.
I have heard that I don't know, some guy, he created a program already
Mm-hmm.
that if you scan and do the X-ray,
Mm-hmm.
you can detect if you have a breast cancer, you're gonna have a colon cancer or
Mm.
whatever, like
Okay.
specific type of cancer.
Got it.
That program,
Uh-huh.
via AI's help, of
Uh-huh.
course,
Uh-huh.
helps you to detect cancer cells
No way.
if you are gonna have it or no. Yeah.
Wow. Okay. Because we also created something like that, but doing early stage lung cancer machine learning model for that.
Mm-hmm.
Okay, interesting. Oh, wow.
Yeah.
So we still need of AI models though to create for businesses.
Definitely. Yes, we
Okay,
do.
nice.
Yeah.
Okay,
That's like good part of it. But
yeah.
I would like to ask you,
Uh
as a
huh. Sure,
professional,
sure.
as a leader of a huge, beautiful team already, I want to know your idea. What you think? What is this development taking us?
I'm not a profession in, let's say, I'm not a doctor or a nurse or anything, but I'll say that it's a tool. Again, in my last episode, I also mentioned that AI is just a tool.
Mm-hmm.
It just enhances you.
Mm-hmm.
So even in the healthcare, I will say it's a tool that can help you uh, make it more efficient task. You know, let's say you're doing a surgery,
Mm-hmm.
the AI can help you either on the training side or trying to help you where what to do and stuff. Try to give you a hand
Mm-hmm.
basically to
Mm-hmm.
make the surgery happen. So that's what I'll say. And
Mm-hmm.
it will not replace, but as you said, it's kind of replacing a doctor. Um, uh, well, is it 100% replacing the doctor, or
I
just
would.
did a task?
Yeah, I wouldn't say
No,
100%
yeah,
because, as I mentioned, the
yeah.
people
It's not
like
there
me.
yet.
Exactly. Because, anyways,
Exactly.
human beings, like people
Of course.
created God willingly, we
Exactly.
are like reasonable people, and
Exactly.
people created those
Mm-hmm.
machines, like,
Exactly.
say, like those tools, as you said. And but the saddest part, what I'm saying, and I mean, like, still people can run it.
Mm-hmm.
But the saddest part, let's say, Elon Musk
Uh huh.
recently created humanoid
Uh huh.
robots,
Uh
which
huh.
are a little bit scary for me.
Tesla bots. Yeah.
Tesla robots,
Mm-hmm.
exactly. Because it's a
Uh huh.
temptation, sort of,
Yeah.
You want to get one for your home, especially today's busy life flow. You want to manage
Mm-hmm.
everything, cleaning, cooking, and stuff. But sometimes, like, girls, women work
Mm-hmm.
as much as men, and there are no time.
Uh huh.
So, sort of, I don't want those roles to be replaced, like women role, man role, like kids are addicted to that.
Uh
Like,
huh.
if we bring it to
It
life.
might help you as you see the Tesla bots. It can, like try to collect the mail for you and stuff.
Mm-hmm.
But look, one thing is missing in them: soul.
So, yeah,
They don't
you're
have
right.
any soul.
And it's man made,
Exactly.
not
So
created by.
they might give you a help. Hey, robot, go grab me a cup of water or something like that. Or something like that.
Yeah,
Those kind of tasks it can do. It's not there yet.
yeah,
Probably in our own decade or in our lifetime or probably after our lifetimes.
yeah.
There'll be all robots over here, left and
Or
right.
flying cars.
Yeah, which they'll was in 2020 or something, right?
Oh
They
yeah.
said
Yeah.
crazy.
Yeah, I don't know. It
Um,
is crazy and scary, sort of,
yeah,
but we
yeah,
need to benefit, like take the benefit. And I like the word you say, use it as a tool, as a
exactly,
help, but
exactly,
never like I have friends, to be honest. I have a
exactly.
lot of people.
Mm-hmm.
If they don't know anything, they ask ChatGPT, ask ChatGPT.
Exactly.
Why?
First, it was
Use your
Google.
brain
Exactly.
first.
Use human intelligence, not AI, artificial intelligence.
So if I compare our life like nowadays
Uh-huh.
and back, let's say like 5 or 10 years ago, back
Mm-hmm.
when I was in Armenia, or maybe you were at college, at
Yeah.
school, we were reading more books.
Books, and then Google a little bit here
Google
and there.
using
Yeah.
a little bit here and there, but now you just first thing you go to Google, you go to
ChatGPT.
ChatGPT.
Mm-hmm.
What you will say like
Yeah.
it's happening, or is it a like good thing, or well, where will it bring us?
Well, there's always good and bad, right?
Mm-hmm.
So on the good side, it can help you achieve what you want
Mm-hmm.
using that. You can learn from it.
Mm-hmm.
It's like research.
Yes.
So ChatGPT is like a research, and it's a data that learned from a lot of data from all the web that actually collects it.
Mm-hmm.
That's all.
Yeah.
We can create our own ChatGPT with our own data or that business's kind of data.
Mm-hmm.
Yeah. Anything else? All right. Thank you, Mariam, for another amazing episode on AI in healthcare.
Thank you.
Thank you, guys. Please like, comment, and subscribe for another episode at Citrus Podcast. Thank you.